Does offering flex time really keep caregiving employees from quitting? Maybe your company offers flex time, maybe compressed weeks, adjustable hours, or work when you want guidelines. So why are caregivers still leaving? Why are burnout and attrition still climbing? But here's the truth. Flex time alone doesn't keep your employees who are also caregivers at home from quitting. And in some cases, it might actually even backfire. In this video, we're going to unpack this. If we haven't met, I'm Dr. Anna Thomas. I'm a physician, leadership speaker, caregiver advocate, and corporate wellness specialist. I help organizations strengthen their workforce and create workplaces where people and performance can thrive together. Even as we enter an era of AI, automation, and agentic teams, the future of work is still human, and that work is changing dramatically. But at the same time, employees are navigating complex personal and professional pressures that are only going to escalate in the coming years. For example, in the next 5, 10, 15 years, we will see an exponential increase in the number of older adults who will need caregiving support. Who will be providing that care? Working adults. Right now, 63 million Americans are caregivers. That's 1 in 4 adults, with more than half of them currently working full-time. Those numbers are expected to increase and will have a tremendous impact on our communities and, yes, even our workplaces. And caregiving is just one example of a personal stressor that will impact the workplace. Mental health, chronic illness, stress, and burnout are all on the rise, and the organizations that will thrive are those that lead with care, culture, awareness, resources, and empowerment. Care. Through this series, I share practical strategies, leadership tools, and insights to help you create cultures that support well-being, strengthen engagement, and retain top talent. If you'd like a clear starting point, then check out my free training, The Future of Work is Care. The link is below. And while you're there, be sure to like, subscribe, and share this with another leader who is ready to build a workplace that cares. Let's get into today's topic. I've seen what happens when companies offer flexibility without structure, without safety, and without strategy. It doesn't retain your caregivers. It just confuses them because flexibility isn't a perk, it is a system. And when that system is unclear or inconsistent, it sends the wrong message. Use this if you dare, but you're on your own. Let's change that. See, flex time is usually introduced with good intentions. But here's what happens when it's not supported. Your employees who are also caregivers, they don't use it. They fear being seen as less committed, losing opportunities, getting pushed out, so they don't flex. They overwork until they burn out. And then team resentment builds. When one person flexes and another absorbs the slack, resentment festers, especially if expectations, transparency, planning, if that's all missing. And that leads to morale issues, quiet resistance, broken trust. The third problem is managers get no training. Most managers are told to be flexible, but not told how. So what happens? Some say yes, others say no, some overextend, others disengage. Inconsistency becomes the culture, and caregiving employees lose out again. Flexibility is only useful when it creates 3 things. The first is predictability. If your flex system changes from week to week, it doesn't reduce stress, it increases it. Your caregiving employees need set boundaries, clear expectations, consistent schedules. Even if they're non-traditional ones, they have to be consistent. The second is permission without penalty. If using flex time leads to missed promotions, subtle shaming, doubts about their commitment, that's not a benefit, it's a risk. So leaders need to model the message. Using support systems is not a weakness. It is smart and supported. Third is team-based design. Flexibility cannot work unless teams are part of the plan. That means cross-training, agreements for coverage, load sharing with consent. Otherwise, you're not offering care, you're just shifting the stress. Let's talk about making flex time effective. We're going to run this through the CARE lens. CARE stands for culture, awareness, resources, and empowerment. It's my framework for helping organizations build workplaces that care. So C is for culture. Do your leaders talk openly about flexibility in caregiving? Do they model it? You can't normalize it when no one even sees. You might try saying, we expect and we encourage people to use flex options when needed. A is for awareness. Do you know who is using the flex time? Who isn't? Why are they using it? Why are they not using it? What do they fear? You can add these questions to your surveys. Do you feel comfortable requesting flexibility? Have your needs impacted your schedule in the last 6 months? And you can track usage by department or tenure or role. R is for resources. Flexibility needs infrastructure, tools for coverage, clear documentation protocols, manager guides for decision making. Otherwise, flex becomes chaos. And E is for empowerment. Ask your employees, what schedule changes would make your workload sustainable? What are the non-negotiables? What kind of rhythm would support both caregiving and your goals? Then co-create the plan. When flexibility is done right, your employees can use it without fear, your managers feel empowered and equipped, your team performance stabilizes, and your employees who are also caregivers, they stay. Because they're not surviving under pressure, they're working with support. That is retention, equity, and leadership. And if you're looking to build a care-friendly system that drives retention and results, then start with my free training, The Future of Work is Care. It will give you the tools, scripts, and strategy. The link is below. And if you want the full blueprint, get my book, Workplaces That Care. In it, you'll learn how to implement the care framework, retain top talent, and create a culture where care is strength, not a liability. You can find it on Amazon. And before you go, remember that flex time isn't just about hours, it's about trust. It's about showing people they don't have to hide or stretch themselves to the edge just to stay in the game. When you give your employees permission to be human, with everything that includes, and the structure to succeed despite complexity, you don't lose performance, you gain loyalty, and that is how modern workplaces win. Remember, in this age of AI, the future of work is still human. So let's create workplaces that care together.